Pediatricians are sounding the alarm about the growing number of children getting infected with COVID-19. They're worried parents may be confused about the warning signs and symptoms. NBC4's Angie Crouch spoke with a local doctor, and she joins us now with information every parent needs to know. Angie.
That's right, Carolyn. Kids make up just under 9% of all the COVID-19 cases throughout the United States. And while that number might seem small, that's over 338,000 kids. Now, 45 children have died in the U.S. And while the vast majority will recover, remember, though, they can spread it to others. But doctors are warning that they could face long-term effects to their health and development. 5-year-old Skylar Herbert from Detroit was one of the first children in the U.S. to die from COVID-19 complications after her brain swelled from encephalitis. Her parents are warning others about the dangers of this virus to kids.
We need to do something about it, and that's one reason why we're doing this interview, is to let people know that it doesn't matter, again, what age you are. It's coming for you.
Researchers are now looking into how coronavirus impacts children's brains, kidneys, and hearts. Dr. Richard Kang heads up the Pediatric Intensive Care Unit at Dignity Health Northridge Hospital. He successfully treated 10 children with COVID-19 and one with multi-system inflammatory syndrome, or MIS-C, which can mimic the symptoms of Kawasaki disease: rashes, red eyes, fever, abdominal pain, and vomiting. 70% of kids who get it are Black or Hispanic. Now doctors are also worried about a resurgence this fall of another rare illness caused by viruses called acute flaccid myelitis.
So a lot of these children will have some type of respiratory illness or viral illness a week before symptoms present. And symptoms may be just something as mild as some arm and leg weakness.
Dr. Kang advises parents to check with their pediatrician as soon as their child shows any unusual symptoms, because in this current environment, it's better to be safe than sorry.
It's that feeling that young people feel they're invincible, that even if they catch the virus, they probably won't get sick, and that's not true.
Studies show children under 10 are just as capable as adults of spreading coronavirus, and doctors warn against even small gatherings with people outside your household.
I think people feel safe as long as they're small numbers, but again, we know that there's a good proportion of people who are asymptomatic carriers, and it just takes one in a party to spread it to 10 people, and then you could see how it can spread exponentially from then on.
And Dr. Kang says kids with pre-existing conditions like obesity and diabetes appear to be most at risk for suffering serious consequences if they do become infected. Reporting live, Angie Crouch, NBC4 News.
Angie, thank you.